Hi, I'm Julia. I'll be your student nurse today. We're just going to be doing a blood draw from your port. So can you confirm your name and date of birth for me? And check the wristband, make sure it's all good. And I'd look at the site, see if there's any drainage, swelling, any pain with that. No. And this is a clean procedure, not a sterile procedure. So I'm going to put on some clean gloves. If this was running, if this had a continuous infusion going into it, you'd stop it for 2 to 10 minutes before you draw the sample. But the first thing we're gonna do, no, not that. We're gonna alcohol off the port. We'll do that for 15 seconds, and I'm watching the clock on the wall. Okay, 15 seconds. And I'm gonna unclamp it, and we're gonna just let it dry for 10 seconds, and I'll do that while I prime my first saline here. So we're gonna attach this syringe. We're gonna aspirate to make sure we do get blood return, and indeed we do. So then I'm gonna flush with the full 10 milliliters. And then you're gonna wanna do a draw up some blood for discard, and the minimum you draw back is 5 milliliters. So just until you think the blood looks good. So I'm gonna just draw that back, and that's gonna be my discard. So I'm just gonna set that off to the side. And we're gonna alcohol off again. Dry. And I have my empty syringe here, and then so depending on how much blood you need for your sample, it should say on the tube, but drop however much you need. Usually it's between 5 to 10. So I'm just gonna drop 7, and then that makes room in case we have we have a little extra just in case we need it. We got our 7. And I'm going to disconnect that, and I'm just going to set it by my packaging so I know that this one's the sample. And then, once again, we're going to alcohol off for 15 seconds. Then we're going to flush with 20 milliliters of normal saline after we're done alcoholing. And depending on the facility policy, you can do heparin flush if that's indicated, but if not, then just use the normal saline. And if it was on a running infusion, you would still flush with the 20 milliliters and then reconnect your running infusion. Aspirate again and flush that full time. And then alcohol one more time, actually. That's for 15 seconds again. And then our final 10 milliliter flush, so that equals 20. And we can alcohol off a final time. And then once we're done alcoholing, we will document the blood, how much we took, what labs it was for, that there was blood return, how much we flushed with, what we flushed with, if there were any complications with the site at all. Other than that, I believe that's it. And then you would use a blood transfer tube to get this into the vacuum container for the blood. So, yeah.